introduce you to our second speaker. She is Dr. Christina Lai Li Ling. She's the head of Transfusion Medicine, UMMC. She is also a member of the Transfusion Medicine Specialties Education Subcommittee. Therefore, she's involved in the training of the entire country's transfusion medicine specialists. And she is also involved in many patient safety and transfusion safety efforts in the hospital. So she's here to share with us her insights on blood transfusion, the true cause behind it. So thank you very much, Christina. The floor is yours.
Thank you, Professor Jahan, for the kind introduction. Good morning, everybody. Thank you for inviting me to share about the blood transfusion and the true cause behind it. So this is my slide presentation. I'll be introducing about blood transfusion, and let's understand about the direct costs involved in blood transfusion. What are the hidden costs of blood transfusion, and how do we evaluate the cost of blood transfusion, and is there any blood alternative, and what is our future directive? Blood transfusion is one of the most commonly performed procedures in any hospitals. The WHO, World Health Organization, has estimated 120 million blood donations worldwide, with about 85 million blood transfusion done yearly worldwide. There is always a constant push for safer, efficient, and cheaper blood products. However, us in the blood transfusion industry, we often suffer from the pendulum of procurement. Sometimes we have good days, we have good supply, and sometimes, especially during COVID times, we have very bad supply until we have to reduce our hospital inventory and etc. So what are the misconceptions of blood transfusion? Blood is free because blood is procured from the voluntary blood donors and they are non-remunerated. Blood is always available. It is off the shelf. We can always order from the blood bank. Blood transfusion costs are limited to direct expenses. That means what we pay to get the blood, and that's all. And blood transfusion is always the most cost-effective option for any treatment, anemia, bleeding, and etc. Blood transfusion costs are insignificant in healthcare budget. We have other things to worry about. The drugs are more expensive, the personnel emolument is not more expensive, and etc. These are all misconceptions of blood transfusion. And blood transfusion costs do not affect the patient directly. Having said that, before we proceed further, let us come to the same definition on cost versus charge. The term cost mean very differently if we were to look at different points of view. Typically, the term cost is defined as the expenses incurred to deliver a service. However, charge is defined as the amount asked by the provider which appear on the bill of the patient. So what do we charge to the patient, and what is the cost that we need to procure blood for blood transfusion? So most of the time, we understand the direct cost of blood procurement in terms of the money that we need to recruit blood donors, the incentive for the blood donor, to organize the blood drive, and for our equipment, laboratory, and facility personnel usage. And when the bloods are collected, we need to screen them and test them using the serology method or the nucleic acid method. And the blood that is procured, we need to process them and produce them into various components so that they can be used for various patients. So this includes our staff, our supply, reagent and consumable needed, facility, and etc. And the cost for blood administration, say a patient requires blood transfusion, the pre-transfusion testing cost, and the process of cross-matching the blood, and the blood being administered in the ward, the reagent and consumable required, the nursing, and all these requirements. And often a time, we overlook administrative cost is very much involved as well. So the MLT will be doing the bench work, but the senior MLT, the scientific officer, and the support system behind will be overseeing the whole smooth running of the whole process of blood procurement to blood administration. And not forgetting our engineering team, facility team, in terms of equipment maintenance and etc., and all the freezers in the blood bank. And they have to be on 24-hour standby to ensure that all these are run smoothly and the blood is always there for our patients. Now, what is the hidden cost of blood transfusion? At the time, when we think about transfusion, we think about the direct costs, which I mentioned earlier. So what are the hidden costs? Transfusion is like a mini transplant. Every time we put in a unit of blood or blood component transfusion into the patient, we can anticipate any of these reactions may occur to the patient. Typically, we classify an adverse transfusion reaction into acute and also delay. Any acute reaction occurs within 24 hours of transfusion, and any reaction of delay occurs after 24 hours of transfusion. Immune reaction is what we really don't want to happen, which is involved in human error. For example, acute hemolytic transfusion reaction. This is what we really do not want. So the blood bank and the hospital management, the quality department has put in a lot of effort to reduce the possibility of human error in causing transfusion reaction. Febrile non-hemolytic transfusion reaction, this is very common. Patients will respond towards the stored blood in the blood components. Allergic reaction, we will not be able to predict what will happen to the patient should they receive any transfusion. Transfusion-related acute lung injury is very rare, but it can occur. Non-immune causes including bacterial contamination, transfusion-associated circulatory overload, transfusion-associated dyspnea, and hypotensive transfusion reaction. And in delayed reaction, delayed hemolytic transfusion reaction can occur as well, especially patients with anti-KIT antibody. Post-transfusion purpura, transfusion-associated graft versus host disease, transfusion-related immune modulation, alloimmunization towards red cell, white cell, and platelet antigen, and very famously, transfusion-transmitted infection, transfusion-related iron overload, metabolic disturbances, and also hypothermia. So typically, a patient will be very concerned about transfusion-transmitted infection than any of other adverse reaction that can happen. So this was in news very recently on 20th May. This was published just last month, Infected Blood Inquiry in the UK. So this happened in the 1970s towards the 1990s, where the screening of HIV and hepatitis C was not routinely done yet during that time. So more than 30,000 patients in UK were given blood which is contaminated with HIV and also hepatitis C, and more than 3,000 patients have died because of this contaminated blood scandal. So now NHS is compensating these patients and their relatives for this infected blood scandal. Now, does this happen to Malaysia? This could, because we only started typing for HIV in the late 80s and screening for HIV in our blood products after that. More often than not, we see worldwide reporting about infected blood or even contaminated blood or blood mix-up, blood administration error, salah transfusi darah, patient who is group O and given group AB blood. For example, in this case, patient is a group negative, but was given a B positive blood. And this case, which happened in 2011 in Malaysia, is one of the landmark cases which really increased the awareness of transfusion error in terms of our Ministry of Health and also in our healthcare facility. This case happened to our unfortunate patient who is actually group O. Unfortunately, due to a lot of miscommunication and also the process error, she was given 2 units of group B for transfusion. And patient ended up having an ICU and was warded for acute renal dialysis. But this case actually kickstarted the awareness of transfusion safety in all our hospitalized patients. So coming back to this, these are the hidden costs of blood transfusion, the complication and the risk. We need to manage the adverse transfusion reaction that could potentially happen to every single unit of transfusion. There is a risk of transfusion-transmitted infection. For example, we never screen for dengue, Zika virus, and some of the virus that could be outbreak in our society. The alloimmunization from blood transfusion, which can complicate further in blood transfusion, we will have difficulty in finding the most compatible blood for the patient, and the long-term health consequences beyond the health institution, especially happens on the recipient, which has transfusion problem. Patient will have a productivity loss, a follow-up cost, and also the management cost from managing all this transfusion reaction. So is transfusion cost difficult to estimate? Yes, the answer is yes, because there is a wide variation in cost calculation and also transfusion outcome. There is also a variation in transfusion practice, and the transfusion process itself is complicated, involves multiple steps and multiple parties. Every time we look at the price tag of a nominal unit of blood, what we see is actually a price tag on the blood unit. And what we do not know is actually the hidden cost underneath all these hidden costs of blood transfusion. So one of the most comprehensive study and also a workshop was conducted in the US about 20 years ago in the effort to finalize and also to standardize how to calculate the cost of a blood. This study looks into 9-step process flow, which capture the direct and indirect costs in blood transfusion, which they look at the time endpoints of completion and outcome and also the track back of the study. This study also including the generic cost elements, administrative costs, the use of IT, purchasing, contracting, inspection, licensing, capital expenditure, quality assurance, which were often performed in the laboratory, training, insurance, physician oversight, facility, human resource, general amenities, and also research and development. So this workshop uses an activity-based costing method to identify the cost of a red cell transfusion. Therefore, red cell unit is identified as the cost subject, and all activities and sub-activities related to it was broken down, and the outputs of each activity was defined, and the resource needed was defined as well. And the cost data was calculated when all these participants goes back to their individual institution and start to calculate each and every one of these personal costs, equipment costs, and etc. Now, the results are quite alarming. So it was estimated that by Prof. Shander and team, in looking into 4 hospitals, a single unit of red cell transfusion, and it was estimated to be about US dollar of 522 ringgit 45 cents, which is equivalent to almost 2,467 ringgit Malaysia. That is only on red cell transfusion in the States. While looking into platelet transfusion and procurement costs as a whole, a unit of platelet transfusion actually costs US dollar 1,359.99 ringgit, which is almost about 4,600 ringgit Malaysia. So this is really very expensive. What about FFP, fresh frozen plasma transfusion? Each unit of fresh frozen plasma transfusion was estimated to be around US dollar 409 ringgit 62 cent, which is about ringgit Malaysia 1,932 ringgit and 46 cents. So these are all very expensive costs that can be incurred to the healthcare and also the patient. So another group in the UK looked into the blood administration costs. Now, in this team, they use a micro-costing method. They take in the laboratory input, the staff time, the biomedical scientist time, the consumable, equipment costs, nursing input, especially in taking blood for transfusion, the phlebotomies, and administer the transfusion, staff time, consumable, and some of the products that go wasted because they are ordered but not transfused, or the plasmas were taught but not used. So Stokes and team looked into the blood administration cost, and it was found out that just by administrating blood, red blood cell costs about 49 UK pound, which is around 294 ringgit. Platelet costs about 58 pound, 348 ringgit. Plasma, 38 UK pound, equivalent to 228 ringgit, and cryoprecipitate, 49 UK pound, equivalent to RM 294 ringgit. Now, with all these blood administration costs and also the cost of a unit of a blood, we know that blood transfusion is expensive. So, what are the alternatives? I would like to remind everybody and also refresh about patient blood management. Patient blood management is an individualized, timely application of evidence-based medical and surgical concept designed to maintain hemoglobin concentration, optimize hemostasis, and minimize blood loss in the effort to improve patient outcome. So I'm grateful that Dr. Fitri and team has always worked with us to reduce the blood usage in any surgical patients. So patient blood management is multidisciplinary. It involves multiple stakeholders from the hospital management to the clinician, the anesthetists, the hematologists, the transfusion personnel, the surgeons, and the primary care, and it is all teamwork and communication with the aim of 3 pillars. Number 1, preoperatively, we aim to optimize erythropoiesis, and intraoperatively minimize the blood loss, and postoperatively to optimize the tolerance towards anemia. That minimal blood or judicious blood and products are used for the patients. Patient blood management is not new to Malaysia. our Ministry of Health Society, our colleagues are doing a lot of work to promote and also implement patient blood management in our MOH hospitals. Patient blood management guidelines in Malaysia has been launched, but the soft copy of guidelines will be shared soon. So the benefits of implementing patient blood management in Western Australia on many patients, 605,000 patients, has proved to have been very, very beneficial. It has reduced 28% of hospital mortality, reduced 15% of average hospital stay, gross saving of 80 to 100 million Aussie dollar, and also reduced hospital-acquired infection by 21%, reduced heart attack and stroke incidents by 31%, and reduce the blood product usage by 41%. The 41% reduction will be a great news to us blood banks, so we can focus on other patient-related care rather than to source for more blood to cope with ever-increasing blood demand in PPM and etc. One of the very landmark study on cost-benefit analysis of patient blood management, implementation of patient blood management per patient. By just implementing patient blood management, it reduced the patient's savings per transfusion per patient to euro 150.63, which is equivalent to RM 766 ringgit. So just by implementing patient blood management, we can save in terms of cost for the patient. What is the future directive for blood transfusion and also patient blood management? In the future, blood transfusion cost is likely to increase because we are facing with an increased aging population. Any aging population, the request of transfusing blood and blood products will increase because the number of people in age-matched donor will be reduced. One of the interesting study done in Germany highlighted that with an aging population, it is estimated that 60% of reduction in the donor age population until 2030. And it was expected to reduce 4 million of donations for Germany itself. On the other hand, blood component preparation will become costly for the healthcare service to support. And as we look at this infographic shared recently, we see that Malaysia, we are facing an aging population with 71% of 60 years and above, and a younger population over here, where under 60 can become a blood donor in Malaysia. So we are looking at 15 to 60, and we are only having about 26% of our potential blood donors with an aging population of 71% for Malaysian population. Last but not least, every time we look at the bag of blood, we need to know that the nominal price tag that is tagged on the blood is just the tip of the iceberg. What we do not see is underneath the hidden cost and the unforeseen costs that can happen to the patient every time they receive a blood transfusion. Therefore, order blood judiciously and make sure the risk is more beneficial. The benefits are more than the risk. Finally, the take-home message: blood is expensive. Blood is natural, finite, and has an expiry. Therefore, it is limited. Blood transfusion costs are enormous and significant in our healthcare budgets. And there is always an alternative to blood transfusion. We can always offer the patients whether do you want blood or is there any other options, for example, IV iron and other methods. As such, I'd like to thank you for your attention and I welcome you to our World Blood Donor Day celebration this Friday. Please come over to Plaza Ruka and be a blood donor. And we will be celebrating our World Blood Donor Day in Plaza Ruka from 9 a.m. to 12 p.m. And there will be many goodies for blood donations, blood donors who donate during the 2 days, Thursday and Friday. Thank you very much.
Thank you very much, Christina. That was a very eye-opening talk. So thank you for sharing how expensive blood is and how it's not a never-ending resource that we can have. And I think whenever we do patient blood management and judicious ordering of blood and using blood as well as judicious point of care testing and precision medicine, so targeting what the problem is and correcting it, in the long run, it's actually safer for patients and safer for our economy. So the floor is open for questions to the panelists. Is everyone shocked by the cost? Oh, okay. All right. Louis Lau has a question. Dr. Christina, is the blood donor day on Friday only? because she was informed that it's on Thursday and Friday.
Thank you, Louis, for the question. Yes, we'll be celebrating on Thursday and Friday, both days in Ruka. You can, Plaza Ruka, you can donate blood on both days. We'll be giving out special goodies to our donors on a Thursday and Friday. It's just that on the Friday, we have an event to celebrate, to commemorate our blood donors. The Pacara will be on Friday, but Thursday and Friday, we'll be there donating blood. Thank you.
Thank you so much. So hope to see lots of people there. Nur Hidayah asks, hi doctor, can share the slides of the recording. So the breakfast at UMHealth will be up. The talks are usually uploaded at the FOM website, but just give us some time to ensure the recording is correct and everything is ready to be put up. So it will be up soon. Thank you so much. Are there any more questions? If there are none, we can end here and continue with our day. So thank you so much to our panelists, Dr. Fitri and Dr. Christina. We look forward to the future that you envision for us. Hopefully, we will move forward in the right direction.
Thank you, Prof.
Thank you.
Yeah.
Thank you so much.
Thank you, Fitri.
Bye.
Bye-bye.
Yeah.
Bye.
Thank you. Bye.